We're back. Thank you so much for standing by. This is Still Help Plus on Mainland 98.3 FM, the sound of Lagos. My name is Sage Babalola. Yes, Alzheimer's disease is the conversation for this segment of the show. Like I told you yesterday, the 21st September, it was a day that represents the worldwide effort to raise awareness about Alzheimer's disease and also strives to more like eliminate the stigma associated with the condition and encourage more tolerance and understanding of individuals who are going through Alzheimer's disease. I did tell you that we would be having a conversation with an expert in the field, an expert in geriatric care, as Alzheimer's is a condition that is more common or more prevalent among the older population. Her name is Dr. Toyin Ajala, and we will be talking to her about Alzheimer's disease. Good morning to you, Dr. Toyin.
Good morning. How are you? I hope you can hear me clearly.
Yes, we can. Good morning. Thank you so much for being here.
You're welcome.
Yes.
You're welcome.
Yes. All right. So I have spoken about the efforts, that have taken place over the years regarding awareness about Alzheimer's disease. But still, we would like you to give us a brief overview of what Alzheimer's is, starting with the meaning, the causes, amongst everything. Just give us an insight into what really constitutes the condition that is Alzheimer's.
Right. Okay. So Alzheimer's disease is one of those conditions that we call neurodegenerative disorders. The cause is unknown. There's a lot of research currently going into there's been lots of research for years now because it's such a debilitating disease. And right now, we still don't know the exact cause of the disease, but we know what characterizes the disease. So it's characterized by progressive memory loss and what we call cognitive decline. It's a very common cause of dementia worldwide. It affects millions of people. And one of the things that we have found in the research that has been done over the years is that the brain starts to become abnormal. So there's an abnormal accumulation of certain proteins and plaques in the brain. That is what characterizes Alzheimer's disease in the brain. And the way it manifests, like I said, is that people start to lose their memory. They start to behave very differently to how they were before. The things that they could do before, they can no longer do them. And lots of people just, when they come, one of the things they say is that, my parent, they've started forgetting things. So that's the first thing that most people say, the first thing that most people notice is the memory loss, that the person forgetting things, most of the time they forget dates, they forget, it's short term. They might still be able to remember their birthday and things that happened 20 years ago, but they start to forget the little things like, it's not really little, but what did you have for breakfast? They can't remember, the things they used to do before, they can't do. Lots of financial issues because quite a lot of people, they just can't manage their finances anymore. They become disoriented. So they're even in familiar places in their homes, and they can't remember how to get to the bathroom. They start to get lost. They can't solve problems. They can't concentrate. Their judgment goes. They start struggling with finding the right word, misplacing things. And then sometimes they start accusing people of stealing their things because they can't remember where to put it. They start getting aggressive. So those are the things that people notice when they, with their loved ones that develop Alzheimer's dementia.
All right. All right. Dr. Toyin, you have used, dementia and Alzheimer's a couple times in your sentences. And I believe, a lot of people sometimes think they're even the same thing, or at least they belong to the same spectrum. So can you clarify on this? Is Alzheimer's dementia? Is dementia a kind of Alzheimer's? What exactly is the relationship between these two, conditions, Alzheimer's and dementia? What is the relationship?
So Alzheimer's is a cause of dementia. Right. So the way I try to break it down in layman's terms is I say, this is the way I say it. So dementia is a condition. Dementia is a condition that affects the brain, and they manifest with the things I talked about, the memory loss, not being able to do the things they could do before, getting disoriented, etc. And dementia has many causes. So it's like fever. So for instance, if you have a fever, a fever that your body is hot, you have a high temperature. And there are many things that can cause that fever. It could be malaria, it could be cancer. Some people have lymphomas and things that can cause a fever. It could be that you have an infection somewhere, a urinary tract infection. It could be pneumonia. So we need to find what the cause of that fever. It is the same with dementia. Alzheimer's disease worldwide is the commonest cause of dementia. There are other causes of dementia. However, dementia is the same. So it's the same way how that fever is the same. Do you understand?
Right.
So fever, high temperature, it manifests the same. So dementia is that condition that manifests with progressive memory loss, with people not being able to do the things they could do before, getting disoriented, misplacing things, not being able to function, can't look after themselves. That whole syndrome, that condition is called dementia. And there are different causes of dementia. Alzheimer's disease is the commonest cause of dementia worldwide. Right. There are millions of people affected by it.
Doctor, talk to us about the age bracket. What age bracket does this start to manifest, or what age bracket would you most likely see a manifestation of Alzheimer's or dementia?
So, I'm a geriatrician. So, as a geriatrician, physician for older people, that is my training, my specialist training. So, I'm a physician, and then I'm a physician for older people. And the older people starts from 65. And really, dementia or Alzheimer's dementia it's a condition of the older age group. There is what we call early onset dementia. It is very uncommon to have early onset dementia. It is very uncommon to have people who are below the age of 60 manifesting with dementia. So dementia in totality, so all of the dementias, Alzheimer's, vascular, Lewy body, they are diseases of the older age group. So really, people over the age of 60. It is not a normal part of aging. It is very important for us to know that. It is not normal. It is not normal. People say, it's old age. It's not. Old age doesn't mean you have to have Alzheimer's or any other sort of dementia. It's just a manifestation. It's a disease of older people. Do you understand?
Right.
Hope that makes sense.
Yes, it does.
Disease of older age, because as people age, the cells get older as well. All the cells in the body, so the entirety of the body can have diseases which. It's not normal. It's still a disease. Do you understand?
Right.
It's just that it is in the older age group.
Right.
Yes.
So
disease.
So are there risk factors, Dr. Toyin? Are there risk factors that would increase the possibility of a person suffering from Alzheimer's, as they grow older?
Yes. Well, first of all, there's a genetic component to Alzheimer's. Okay. If you have one parent with Alzheimer's disease, then you are, I believe, is it 10%? There's like a 10 to 20% chance of that person developing Alzheimer's in later life as well. It's two parents. The likelihood of developing Alzheimer's is even higher. I think about 30%. Just growing old is a risk factor. Advancing age, unfortunately. We all want to grow old, but just growing old, just being elderly puts you at risk of having Alzheimer's disease. But really, those are the two main risk factors. Then apart from that, there are lifestyle factors. So for me, and I'm one of those, I'm a healthy aging advocate. And part of, when I talk about healthy aging, I always talk about lifestyle, sedentary lifestyles, not exercising. Having a sedentary lifestyle where you do not participate in any sort of physical activity would put you at risk of having dementia or Alzheimer's disease.
Okay.
It has been proven. Yeah, it has been proven that if you exercise regularly, you're 30% chance of not developing that disease.
All right.
Yeah.
Well, thank you very much, Dr. Olutoyin. In the few minutes that we have left for this conversation, let's talk about the diagnosis and then move to the treatment and the management. There are certain conditions where the signs and symptoms would manifest the same as a completely different condition. So it would take, the interference of an expert to be able to separate that this is exactly what is going on. So in diagnosing Alzheimer's disease, what are the processes? And then talk to us briefly about treating or, well, in this case, managing the condition.
So, in the first instance, if you start to notice that someone around you is behaving the way I talked about before, memory loss, disorientation, not being able to do the things they could do before, all that kind of decline, then you need to seek specialist attention. So I would say you need to take the person to a doctor, a specialist. So someone like me, a geriatrician, an old age psychiatrist or psychogeriatrician, you need to take them to a specialist for an evaluation. So they come for an evaluation, they come for an assessment, and we try to establish the diagnosis of dementia. Up till very recently, there were no specific tests for actually diagnosing dementia. It was on, what you tell us in terms of the history, and when we do what we call cognitive testing, where we test the person's memory and, cognitive abilities. That was how we made the diagnosis. But now, with the advances in things like MRI scanning, we do MRI scans that can help us to determine what exactly is going on. So with MRI scanning, so if you come to me, for instance, once we've done the initial assessment, so the initial assessment would take the history, would do a physical examination, would do our cognitive testing, we'll test that memory, do a memory test exam, and then I will send you for an MRI head scan. And on that MRI head scan, there are specific things that will tell me whether you've got Alzheimer's disease, that will point towards, Alzheimer's disease, or point towards some other diagnosis. Do you understand?
Yes.
And then we know what we're dealing with, because the treatment for all these conditions are different.
No one size fits all. We have to understand more specifically what's going on.
Yes, but there's no two ways. You have to take and earlier is better, because like you said, it's about managing the condition. So what some people do is that when they start to see these things, because of the stigma around dementia, they keep their elderly person at home. They don't seek any medical attention until it has become so bad that by the time it comes to me, it's it's gone so far that really the damage limitation is just, that's basically what we're doing. But for many people, when they come early, we're able to intervene early to slow down the decline. There is no cure for Alzheimer's disease. There is no cure. There's lots of research going on, lots of treatment modalities coming out, giving lots of people hope. But as of this minute, there is no cure. But we have medication that can slow down the progression of the disease, slow it down. So you can imagine if we diagnose it at 75. If we're able to slow it down that by 90, if we can give like 10 to 15 years of a good life, that's great. Do you understand? So there's medication and there's behavioral management. There are all sorts of things there. There are interventions that we can put in place early that prevent that rapid.
Hello, Dr. Olutoyin. Oh, I apologize, the connection.
Hello?
Oh, yes, we have you back. Thank you so very much. We had a signal interference right there. So, Dr. Toyin, finally, if you can, in about a minute, just talk to us about the public or society's willingness to understand people who suffer from Alzheimer's disease. I know that first things first, there's elder abuse, which is a primary concern in this part of the world, especially in Africa. There's the condition of elder abuse or the situation of elder abuse already. And then with an elder who has Alzheimer, we can only, imagine what that person is going through. So talk to us very briefly in a minute about the need for society to understand, help and encourage people who go through this condition, and understand it is not something of their own making. It's either genetic or it's just one of the things that you might experience as you grow older.
Yes, it's unfortunate that in 2023 we still have lots of places in Nigeria where, in fact, probably the whole of Nigeria, where people think when they see someone manifesting with dementia that they're witches, that they've got this spiritual problem, they lock them away. Some you see elderly people wandering the streets. They don't know who they are. They don't know where they're from, and there is still that stigma in the society. It is getting better. I must say it's getting better because, I've been practicing in Nigeria now for the past 5 years. So, it is getting better because of awareness, because of, kudos to you for doing this. People just need to know this is and it is so common. So, years ago, lots of people thought, they were suffering they thought they were suffering in isolation. They didn't realize how common it is. They didn't realize that there were treatment options, there were management options, so it's with the education and with this sort of like public awareness program that we can get people to see that first of all, it is not an isolated problem. There are thousands, millions of people who are suffering like this, even in this country, even in Nigeria. And the elder abuse, that is just over the top. Lots of people, they're being cared for by other people apart from their own children. Quite often you have there's some I don't know, family member or some carer or someone who's meant to be caring for this elderly person with dementia. I've seen financial abuse that has been mind-blowing. We've seen physical abuse that has been mind-blowing, and, it's just important as a society. We've got to do better as a society.
Thank you so very much, Dr. Toyin Ajala. We are out of time, but this was a very enlightening conversation, and we appreciate you for your effort, taking care of the elderly and also lending your voice, in spreading awareness and also sensitizing people about conditions that are somewhat peculiar to the older people. We look forward to having another conversation like this one with you, Dr. Toyin. Have a fantastic day.
Thank you. Thank you very much.
Yes. Okay, and that is it. This is where we draw the curtains for Health Plus for today. Thank you so much for joining us. We appreciate you. Join us next week, Friday, from 10 a.m. all the way to 11:30 a.m., where we're going to be having full conversations like this one. My name is Sage Babalola. Coming up next is the news headline at 11:30, and right after that, it will be time for Still on the Matter. Don't go anywhere.
Mainland 98.3 FM, the sound of Lagos.